Good people, every once in a while, you meet someone whose story reminds you that purpose can emerge from the very thing that tried to derail your life. Joining me today is nurse practitioner Laura Cheng. She's someone I'm proud to call my friend and my sister in acromegaly. Laura specializes in endocrinology at Emory Healthcare, where she helps patients navigate some of the most complex hormonal and metabolic conditions. But her connection to endocrinology isn't just professional, it's deeply personal. At just 22 years old, Laura was diagnosed with acromegaly, and instead of allowing that diagnosis to define her limitations, she allowed it to shape her purpose. She went on to earn her Bachelor's of Science in Nursing from the University of North Carolina at Greensboro, spent nearly 7 years working in the endocrinology division at Duke University, and later earned her Master's in Science of Nursing from Duke University School of Nursing, where she also completed an advanced endocrine specialty certificate and trained under Dr. Atil Kargi, someone who's already had a conversation with me here on the podcast. She is also someone who recently underwent radiation therapy, continuing to face her journey with extraordinary strength and grace. So today, we're talking with someone who understands acromegaly from both sides of the exam room. Laura, my friend, welcome to Talking Acromegaly with Tony. It is a pleasure to having you join me today.
Thank you, Tony. I think the pleasure is all mine. I feel very honored to be here with you. You've done some amazing advocacy work and spoke to some amazing patients and providers to get the word out about acromegaly and the challenges that we face. So I want to thank you so much for being part of my acromegaly family and brother, and always being there to support me. And thank you so much. I'm just so glad to be
We are
here.
all in this together, Laura, so let's get right into it. Before we talk medicine, I want to talk about you. Laura, you were diagnosed with acromegaly at just 22 years old. Most people in their 20s are trying to figure out who they are, where their life is taking them. What do you remember most about receiving that diagnosis at such a young age?
When I received my diagnosis and first heard the word acromegaly, I didn't quite know what it meant and what that entailed for my future. I remember being frustrated of knowing that something was wrong, but I couldn't quite pinpoint what it was that I was experiencing. And I was also having to raise my twin boys who were toddlers at the time they were born, in 2011. There was a lot of components that were going on in my life at that moment in time, and it was hard to focus on a multitude of things when really my children took priority. But I also knew that something wasn't quite right and that it was also my responsibility of working with my team to figure out what was going on. Um, and when I received my diagnosis shortly after Christmas in 2012, I think I was still stunned because I didn't know exactly what the next step was. There was a lot of conversations with my endocrinologist at the time. And there are times even now where I was frustrated that I was diagnosed at such a young age, but also blessed because I was diagnosed very early. Really, I think my first symptoms started when I graduated high school back in 2008. But many times I associate the beginning of my journey with my diagnosis. I often wonder sometimes how my life would have looked if I was diagnosed a little bit older and not in my prime 20s when life was supposed to be good and beautiful. But I think there's a reason for everything that happens in life, and there was a reason why I was diagnosed at such a young age. And yeah, here we are several years later, over a decade later, and we're still navigating the complexities of acromegaly.
I also believe that everything happens for a reason, and that my reason for having acromegaly is to be able to help others navigate what they're going through and give them strength and courage to move forward. At the time of your diagnosis, did you fully understand how profoundly it would shape both your personal life and your professional path?
Absolutely not. At the time, when you're young, sometimes you're just looking at that moment, that day, and not really dreaming so big about the future and what it entails. At the time of, being young, I also didn't think that I would be a mother in the future. That was not a goal that I had necessarily set out or invested much thought into. So I was very much a person of you take life as it comes to you, and you experience it, and you try not to mold it to exactly what you want, but you still make plans along the way. But having been diagnosed with acromegaly, I think that changed my mindset because I had to be focused on treatment journeys, medications, plans for surgery, what that meant in terms of, who was going to take care of my children so that I could also take care of myself at the same time. So it really did change the trajectory of how I thought about the future.
So it seems that looking back now, that you do believe that acromegaly found you in some strange way, help you discover your current purpose.
I heavily believe so. I remember when you're at that trajectory of graduating high school and you're trying to figure out what you want to do with your life, and family starts asking you, "What do you want to do? What do you want to be when you get older?" I often joke about it because looking back, it's actually quite funny. But I remember my mom and my sister and my grandma asking me, "Well, don't you want to be a nurse? I think you would be a great nurse." And I starkly remember laughing at that and saying, "No, no, no, that's not what I see for myself. I think I want to go do travel and tourism because that's adventurous." And obviously, none of that panned out. And I am where I am today. And that wholeheartedly, I believe, has to do with my diagnosis with acromegaly. I had a really dark time in my journey where I felt as though my family, my loved ones did not understand what I was going through. I also felt like I didn't fully understand everything that I was experiencing. And then also having your endocrinologists and medical professionals still learning about acromegaly right alongside you, you sometimes feel like you're alone and not quite understood. And I remember shortly after my surgery kind of feeling that in the pit of my stomach, but I had some really wonderful nurses at the bedside that would come and have conversations with me and talk with me. And I remember sitting in the room alone, and after they would leave because they would have to rush to the next patient that they were caring for, that the job that they were doing was so rewarding and so impactful that I wanted to do that for someone else. And that's when I realized, like, this is my purpose. I have to pursue this, and I have to be that for someone else who's going through the darkest time in their life.
That's amazing to hear. Acromegaly definitely found you for a reason. I'm going to switch gears a little bit. You trained at Duke, completed an endocrine specialty program, and now practice at Emory. At what point did acromegaly stop being something you learned about and started to become something you had to live with?
I think along the way, I always felt like this is something that I'm going to have to live and traverse. There's not a lot of education about acromegaly or very rare endocrine disorders throughout nursing school. It's not something that's heavily focused on. But I remember, and neither is it, throughout nurse practitioner program either, because you're trained as family nurse practitioner, and given like a broad education. But I remember working in the endocrine clinic at Duke and wanting to be more involved with the decision-making skills of the treatment plan for the patients. Because in a clinic setting as a nurse, you're doing a lot of like the intake, a lot of the prior authorizations, a lot of communicating with the insurances, which is great because it taught me and educated me on like the problems that you face as a patient, but also on the provider side of navigating the complexities of not just the diagnosis. But I knew that I wanted to have more of an impact on my patients from a direct standpoint, and that encouraged me to pursue my master's at Duke.
I give so much credit to people like you who are able to be diagnosed with acromegaly and still push forward with their education. I'm so thankful that my surgery came a little later for me in life at 43 years old because since my surgery, my brain fog has been one of my biggest symptoms. And I couldn't imagine having to attend not only college, but a nursing program after having my surgery. So kudos to you. Great job. How has living with acromegaly changed the way you listen to your patients?
I live by the thought of your patients will not always remember what you say because we say a lot of things to a person during a office visit, but they will definitely remember how I made them feel. And why I live by that is because I experienced throughout my journey a lot of, I want to say medical gaslighting, if that's the correct term, but a lot of challenges of feeling like I was being heard or listened to. I remember after giving birth to my twins, at that point, I still didn't know that I had acromegaly, but I knew that I had high prolactin levels pre pregnancy. And I didn't have good follow up while I was pregnant, and that was, partly my fault because I didn't quite understand the complexities of what that meant. But I remember having a very excruciating pain in my head after I gave birth to the kids a few weeks later. And it almost felt like someone was taking an ice pick to my head and just stabbing me there. And I would cry trying to lay my head down on a flat surface or walk down the sidewalks. And I remember going to the emergency room several times and I was given IV fluids and essentially told this is a post pregnancy headache, things will get better. But at the frequency of me going to the emergency room, I knew that something wasn't quite right. And about the fourth or fifth visit, that's when I realized that I have to stand up for myself. I'm not being heard. And I know that something is not right. So I told them, something is wrong with my head. I don't know what it is. Can you please, please help me figure it out because I can't leave and turn around and come back a few days later. And they performed a CT scan that showed that I had a pituitary adenoma. And they referred me to a neurologist who later did a MRI with and without contrast. And that's where we learned that the tumor had actually hemorrhaged out. So it was frustrating to express that something wasn't right and not feel heard. And so if my patient comes into the clinic and they feel like I'm not truly listening to their concerns, but they're not quite comfortable advocating for themselves, my fear is that they won't be comfortable coming back to me, or they'll come back to me and they won't be open with, their thoughts, their concerns, their fears, their frustrations. And I want my patients to feel like when they come into the office and I close that door after I come in, that it is a safe space for them and that there's no judgment. And even if I am not quite sure what's going on or I don't have the answers, I want them to know that they have a trusted person behind them that will try to figure out what the issue is and look into it further, or at least, help find the right provider who does focus on whatever their concern is and get them to the right spot. And I had some providers like that along the way. I can't say that throughout my journey it was all frustrations. Um, I've even had an endocrinologist who missed my diagnosis despite me giving very clear signs about the hands and the feet growing during pregnancy by not small measures by any means. Um, but there have been providers, and I remember one starkly. I had met her once. This is the very beginning. She was the provider that diagnosed me. And I had mentioned all my same symptoms to her that I mentioned to the previous endocrinologist. And she really put her Sherlock thinking cap on and really went to bat for me to figure out why I was experiencing what I was experiencing. And I remember her to this day. I'll never forget her. And I try to be an example of her when I meet my patients.
You are a prime example of why it's so important to advocate for yourself, to stand up and not take no for an answer. You mentioned the size of your hands and your feet. Can you tell us what size your shoe started at and what kind of grew into?
Certainly. So, pre pregnancy, the only symptoms that I experienced were amenorrhea for about a year prior to becoming pregnant with my twins and some discharge from the breast. But I didn't really equate that so much to anything abnormal. I thought it was the fact that I was taking birth control at the time, and had come off of it and that my body just needed a reset period. But at a year mark, I realized that no, that's not okay. My wonderful partner in life, who I met at the tail end of high school, had already started talking about children, and we we weren't even married yet. So you could tell we were young and in love. So I decided, and we decided together that we would go see an OBGYN to figure out what was going on. And that's when we found the high prolactin levels. It didn't take very long to get pregnant. It was just 4 months later, after being put on a oral medication to reduce the prolactin levels and another tablet to help jumpstart my cycles, that I became pregnant. But that's when the symptoms hit me pretty hard because my foot size was a 6.5, and by the end of my pregnancy, it was a 9 wide. My ring size, I remember having to take off my wedding ring because it was getting very tight and I didn't feel comfortable leaving it on. But it had went from a 4 to a 7 within the time that I was pregnant. I remember buying a pair of rain boots because we were in New York at the time and it was heavily snowing, and I was fearful that if I didn't buy rain boots that I might fall or slip while I was pregnant. But it was just a few months later that I couldn't fit my feet into them anymore. And I remember thinking, that's really odd. I know your hands and feet can grow while you're pregnant, but this seems to be quite a larger scale than what others had mentioned. But again, even throughout the course of my pregnancy, I thought about these symptoms, but didn't invest a lot into them or try to figure them out.
I didn't try to figure out my symptoms until I couldn't fit my shoes, in particular my Jordans. So I kind of jokingly say Michael Jordan helped me with my diagnosis because it wasn't until I couldn't fit into my most important shoe collection that I focused more on my acromegaly. Let's switch gears one more time, Laura. You recently presented
Okay.
at the American Association of Clinical Endocrinology. What was it like to stand before your peers as both a clinician and someone living with a rare condition that you also help to treat?
It's always a little nerve wracking to be on a stage with, over 50, 70 people sitting in the audience, some patients, some providers. and presenting on something, especially your life. But I think today we're doing that on a even larger scale, you and I. So it's always a little nerve wracking. But when you're speaking about your diagnosis, your journey, and it translates to education for a provider, making them feel more knowledgeable about the disease state or the treatment or what someone is truly experiencing during their lived journey with acromegaly. To know that that also somehow translates to the next person that they take care of or another patient that walks through the door is so amazing that it makes it all worth it every time that I go and I speak alongside another physician who's discussing whether it be the medication or a treatment algorithm. I think it's a blessing that providers get to actually hear a patient's story because, as we know, an office visit can only be so long, and having the opportunity to share everything that you're experiencing in such a short time span can be very difficult. So it may make the provider think about things that they do need to ask, given the time crunch that sometimes they're experiencing in the clinic.
I truly enjoy sharing my story, and I'm extremely thankful for the opportunities that I get to do so. I realize how much of my storytelling has helped with the growth and confidence of other people living with this rare condition that we both share. How has your family helped you sustain throughout this journey?
In the beginning, I think it was difficult for them to understand what exactly I was going through because acromegaly was a word that none of us have heard of. And most of my family members are generally healthy. So to see me go through something so difficult that changed not only my physical appearance, but my mentality, I think that was very challenging for my mom because I was a very carefree, laissez faire individual prior to undergoing my surgery. And I remember my mom specifically telling me shortly after, I can't remember if it was my first surgery or my second surgery because they happened so close together in 2013. But she had told me that I seemed more anxious, I seemed to worry more, and that I just seemed stressed out in general. And sometimes I wondered whether that was the acromegaly or if that was just me being a young mom at the time and having not just one, but two little ones running around. Or maybe it was a culmination of all the things. And it was also pretty hard opening up to your significant others because you would express certain things knowing that they fully wouldn't understand what it meant, right? Because acromegaly, it can be an outward thing that people can see, but for me being diagnosed as early on as I was, I didn't experience all of the changes, the facial changes that one would expect. I've had a lot of providers say, well, you don't look like you have acromegaly. But that doesn't mean that the disease isn't present and that I'm not experiencing some of the other complications, such as arthritis. My husband, I have to say, has been my rock throughout all of this. I often like to joke and say, "Oh, he still tolerates me." But he truly has dealt with a lot throughout this. When there are times where I wanna be down, he has to be and has been the person that has picked me up throughout all of this. And I also don't think without him, I would have been confident enough to pursue nursing. I remember when we met right out of high school, I was planning to go to college, a university, but I was also fearful that if I did so, that our relationship wouldn't work out in the long run because we would be going in opposite directions. So I hightailed it back to him pretty quickly, I would say. And I'm so glad that I have because we've been together ever since. And there are still some days that he had to pick me up when I was so angry and frustrated at my late night journeys to the proton radiation center because I'm a pretty stubborn person, Tony. I like to do all the things and be the person that can handle everything on their plate and sometimes shove a lot more than what I can necessarily handle because I don't always want an individual to see that I am nothing more than what I aim to be. But I remember we were doing fractionated radiation last year between November and December. I would go to work in the clinic 8 to 5. And of course, the commute time was extra on top of that, 40 minutes each way. But then I would drive home, maybe have time to eat dinner, wrap up a few charts before I hightailed it back to the proton therapy center where sometimes my sessions were delayed. So there were times where I wasn't getting home till midnight, and about halfway through, I questioned why I was doing radiation and whether it would work because when you've been through the whole treatment algorithm that is acromegaly, and we know it's not necessarily a short one, there's a twists and turns that you can take on that. When you've been through that, sometimes you lose a little bit of hope that, well, if this medication hasn't worked and that medication hasn't worked, and this one is just holding down the fort, but has worked pretty effectively, but I'm not quite near goal where they want me to be in that perfect IGF-1 range to mitigate other consequences that can happen to your health. You lose hope somewhere down the line. And that can be frustrating for you, but also for your partners who are helping you navigate it. And I remember just sitting in the car crying and saying, what am I doing this for? In the end, like, is it going to help me achieve that IGF-1 that we've been aiming to get into the normal range for over a decade now? And without him, I probably would have stopped going to my sessions realistically because it was a lot to handle. So I'm always grateful that my husband is by my side and being my cheerleader. I couldn't do it without him. And my children as well. They may not fully understand. They can tell that sometimes it's a little bit harder for me to get off the couch when my arthritis is acting up. But I think they understand to some degree that it heavily impacts my life more than what I would like it to. And I hope that when they get older, if they experience anything half as challenging as this, that they understand that you can still set out and pursue certain things despite the challenges that you may face.
What did that whole experience of radiation teach you about yourself and perseverance and hope?
It taught me that I am a pretty strong individual to have gone through so much. I'm often my own worst critic, as some of us are sometimes. And we don't always think of ourselves as a person that can persevere and remain resilient. But I think retrospectively, when I look back on it, I'm like, wow, I did this. I went through 6 weeks of fractionated radiation therapy. Um, and I didn't give up like I thought I would halfway through the journey. So I am a resilient person. And there have been other instances or areas in my life where I've experienced challenges, whether that be nursing school. I remember throughout that process of my life that I wouldn't make it through, or that it was just so challenging that sometimes you want to throw in a towel. But looking back, I realized if I set out to do something, I achieve it. It doesn't have to be a perfect road. It doesn't have to be a road that someone else has taken. It's my own way, and it's okay if there's, like, blemishes along the way or a rocky path or a hole that you step in, so to speak. That's okay because at the end of it, you are molded into a version of you that was even better than the person before. So I think that's what the radiation showed me at the end of the last 6 weeks of going through that experience of, you are such a strong person. And as a result of that, hopefully you can be strong for someone else who's also going to experience this journey, or not this journey, another health challenge that's just equally as difficult.
Let's talk about the results of that radiation that you didn't give up on. If I can give a drum roll, where are you at now, IGF 1 wise?
I actually received my results earlier this week, and as you and I know, Tony, radiation, when they speak of it, doesn't typically work very quickly. Usually it's years down the line, whether that be 3 or 5 years is the estimate that we're given. But as I was talking to a friend on the phone, kind of talking about, the stressors in life, although I, probably shouldn't be looking at my phone, when you get that ping that a MyChart lab result has come through, despite what you're doing in that moment in time, and you've been waiting for this number to hopefully at some point be in the normal range, which for me has never really been. I'm always like slightly above the reference range. When I opened that MyChart result and I saw 195, smack dab in the middle of normal, I almost didn't believe it. I know. I think I'm still in disbelief. And a little part of me was joking in my head. I'm like, did they switch my results with someone else? Wait, whose IGF-1 is this? But then I sighed the biggest sigh of relief and got the biggest glimmer of hope that I finally have crushed acromegaly and I've gotten ahead of it after it's had me for all these years. Not that it didn't give me beautiful things along the way. It definitely has. It's given me challenges and it's given me these glimmers of just new experiences, meeting new people, building a career. But when you feel like you've come on top of a mountain that you've been trying to climb for years and you stand at the top of it and you've defeated it, that's what it felt like when I simply opened a MyChart result.
That was a huge win. All the long nights paid off, all the tears, it all paid off. It took me quite a while to get my numbers in range, partly because I wasn't taking my medication, but that's a whole nother story. Has going through that treatment again deepened the empathy and perspective you bring to your patients?
I realize that when I see someone in the clinic, I see such a small fraction of them in that moment in time. I don't see their whole being necessarily, what they're like in their home life, what they're experiencing, those challenges. If I'm lucky, a patient will divulge all of the things that they're facing. It's amazing to me how resilient patients can be when they've been battling something for quite some time. I primarily do a lot of diabetes management, weight management, and I think my experiences have shaped me in a way that I can meet them to some level, right? Uh, of yes, I'm a provider, but I'm also a person behind of it. And I'm also a nurse, and we are very compassionate and caring and look at the whole person. But also, as a nurse practitioner, we're looking at the science behind things and the pathophysiology. I want an individual who's coming to see me know that I will be your advocate along the way and I will be a support person for you, even in the times where you maybe aren't able to do it for yourself. I have a lot of patients who as you had spoken, Tony, maybe weren't ready to be diagnosed or aren't ready to handle the complexities of what that management may look like because it's not an easy thing. Maybe for my patients, it's not just a day-to-day thing, but what they eat from meal to meal and how that impacts their well-being. But even if you're not ready, I'll be there for you. And if you keep coming to see me, hopefully I can get you to a spot where you feel like your quality of life has improved. Because for me, especially in endocrinology, other endocrinologists, we're very numbers focused. We have to be. The numbers are important. It guides the treatment. But behind those numbers is also a person with symptoms that they're experiencing. And a lab value can be normal. It can be smack dab in the range of normal. But that doesn't mean that the patient isn't experiencing what they're experiencing. And we have to, as providers, with our due diligence, hear them and make sure that our patients feel heard. Because I don't think I've met a single patient who came into the clinic who told me a symptom just because. They're telling me for a reason. And if I discredit that, I'm doing them a big disservice.
I'm so glad you mentioned the numbers aspect of it because we are so much more than just a number. With that said, if one of your colleagues or another healthcare provider hears this conversation, what do you hope they can change in the way they evaluate patients with unexplained symptoms?
If I can tell my colleagues this one simple thing, because I also see the provider pressures from a clinic standpoint, the time constraints, the volume of patients that you see, the challenges that are put upon you to meet all those expectations as a provider or, my physician counterparts, other nurse practitioners, PAs. If you truly take the time to listen, and I mean truly listen, you will get half of the answers of what you're searching for. You will get lots of jigsaw puzzle pieces to help you put that puzzle together. And it may not happen the first encounter or the second encounter, but I bet you as time goes along and you build that rapport with your patient and your patient feels comfortable coming to you and having discussions and opening up more, you will figure it out. You will have such a wealth of knowledge for you to then move forward to develop the treatment plan and improve this person's quality of life. And when I say improving the quality of life, I think that's different for every patient. We experience acromegaly different, right? Um, some experience it harder than others. But I think that's the important part of a provider is understanding how it's impacting you individually as a person and the outcomes that you want. Even if it's minimal improvement in, let's say, arthritis, if that's getting me one step closer to me feeling like I'm living a good life, that's what I want my provider to help me with. And also, in conjunction, getting those numbers to go, but as a two-pronged approach.
Do you see your provider at Emory Healthcare where you work, or is your provider with another hospital?
I do see the pituitary specialist at Emory. She's at the Midtown location, and I've actually trained with her one-on-one. I've taken my admin days, which are days that I catch up on my in-baskets, my calls, my patient messages, and I reached out and she was willing to train me. And so I did that prior to her going on maternity leave. And I've built that connection with her, and I hope she knows that I'm always there to support her. But yes, I mean, I definitely see the pituitary specialist at Emory, and even when I worked at Duke in the endocrine clinic, I was a colleague to my provider, but also a patient, and so that's kind of a unique situation to be in. Um, I do remember my provider at Duke. I wasn't always forthcoming with her about all of the symptoms that I experienced. I think also because we were so focused on the number, but I didn't feel like I was doing my due diligence to explain to her everything that I was navigating. One of the hardest parts was the weight gain that happened after surgery, and not by a small measure. I think when you spoke to Jill on a previous podcast, she had mentioned some of the weight concerns that come afterwards. And I didn't heavily express the mental health impact that had on me throughout the years, and not feeling like I was myself, not being the same Laura that I used to be, and also missing out on my quote unquote golden years of my youth. And now I've learned that if I don't communicate that, if I don't share that with my provider, there's no way that they're going to know. So even if I am friends or colleagues or a patient to my provider at that moment in time, I have the due diligence to let them know what's bothering me and what I want out of my treatment journey so that I can be the best me, because I need that in order to continue to do what I'm doing on a day-to-day basis, not just as a mom, but also as a provider and a wife.
You mentioned Jill. We always got to take the opportunity to give a shout out to Jill Cisco every opportunity that I get. With that said, I want to take a step back a little bit, Laura. At what point did you know endocrinology was more than just a specialty? It was actually your calling.
I think I knew pretty early on, when I went to nursing school, that endocrinology was going to be my calling. Because when you're in nursing school, you have a cohort that you study with, and a lot of my male counterparts had their eyes set on specialties such as the ICU, cardiology, and then my female counterparts were often looking at OBGYN or mother baby or the NICU. And I was kind of that odd bird out that said, no, I have my eyes set on endocrinology. And I remember some of my colleagues, fellow students, looking at me like I had three heads and questioning, why endocrinology of all the things that you could choose? Endocrine is complex, is the word that they would use. It's challenging. It's difficult to understand all the conditions in the endocrine system. But I saw it as a wonderful challenge. I love the complexities of the hormones and how that interplayed with our body and how it made us feel as individuals on, a level of our day-to-day functionality. And so I knew early on there was no other specialty for me but endocrinology. However, when you finish school, you're often encouraged to go to the bedside and work as a nurse in the hospital. And so I worked on a medical surgical unit. And I think that was a really good place to start because you were able to see a broad, wide array of diagnosis. And one of the things that you were going to see most often was diabetes. And that's a lot of what I do on my day to day right now. And that is also a very challenging but common diagnosis. Not as rare as acromegaly, but just as difficult to navigate. And so that was great. I enjoyed that. However, As soon as I saw a position open in endocrinology, I snagged it. I went full throttle with it. I said, "This is if I don't take this leap now, who knows when I will have a chance to pursue it again in the future." And I remember putting in my application, being eager, ready to jump in, and luckily I got the job at Duke Endocrinology, at the main campus, and I stayed with that division for over 7 years, or almost right at 7 years, I would say.
So then you start your advanced training, and you had the opportunity to learn from our good friend, Dr. Atil Kargi, a physician that's well known in the pituitary community. What impact did that mentorship have on your development as a clinician?
Well, I have to give a big, immense shout out to Dr. Kargi because when you are in your training for a nurse practitioner, you're often focused on a wider range of things, primarily to be put in a family practice, um, or in a primary care provider's office. And so your training is not heavily focused on the complexities of an endocrine system. I mean, you have thyroid and you have diabetes that you are primarily focused on in that training. So I was grateful to one of my mentor, Dr. Catherine Kreider, who is the lead faculty at Duke in their endocrine specialty postmaster's certificate program. And that's why I chose Duke as my place of where I was gonna do all my studying, my preparation to be a nurse practitioner, because they were the only one in the United States that had that as an option, and I knew what it would take for me to be a good endocrine nurse practitioner was to seek out people that had that knowledge base who could make me a strong provider in that specialty. And so I told Dr. Kreider, I love that we were doing general endocrinology, but if I do not have the chance to focus on pituitary management, I feel like I will be doing myself a disservice and all the patients that I see afterwards. And the one thing about a nurse practitioner program is some schools will help you find preceptors and others will not. And sometimes you are seeking them out on your own. And that can be very, very challenging because you're asking a provider who's already seeing a lot of patients and has a busy practice to take on a student. And that's a lot of effort and time on top of everything else. I remember sending Dr. Kargi an email, and I was a little apprehensive at first. I said, "Who am I, this little nurse practitioner student, to ask such a task of this big endocrine provider who has all this wealth of knowledge at UNC to take me on as a student?" And I kid you not, Tony, within 2 days, if not the very next day, I got an email back and he, with open arms, welcomed me into the clinic to come and mentor with him. And I was able to see his approach towards patients. If anything, I kind of see him as a walking textbook. He has got bits and pieces of knowledge just stored in his brain, ready to throw out, a random fact about X, Y, and Z. But I also was able to see that every step of the way when he was in clinic, he would recognize something as an opportunity for, oh, that would be a great research study, or, oh, this would be a good quality improvement thing that we could work on. And boy, do I sometimes wish I would have had the opportunity to stay there with him and train for longer. But that just translated to me that he wholeheartedly cares about the work that he does. And I took bits and pieces of that with me when our training ended.
So it seems as though you may have had a defining moment with Dr. Kargi that you may have realized I want to dedicate my career to helping people face the same kind of challenges that I live with. Were there any other influential healthcare providers that you were able to train with that helped sculpt your career?
Yes, there is one that I took my admin time with, and admin time is where you're catching up on your in-baskets, your patient messages. I have I had advocated when I joined Emory that I had an interest in pituitary management, and I was awarded the opportunity to work with a pituitary specialist at Midtown, which is one of the larger Emory locations, named Dr. Hawk. And I spent a few months training with her before she went on maternity leave. And she was just an immense wealth of knowledge. And I've also had other mentors along the way, such as Dr. Yednak, who you also did a podcast with, and we work closely in the Endocrine Nurses Society together, and Dr. Catherine Kreider, who is lead faculty for the endocrine specialty postmaster's certificate at Duke. I've had a constellation of people in my life that have molded me into the nurse practitioner, but also the person that I am today. And for those individuals, I'm immensely grateful because that extends not only to me, but, any other students that I might go and train in the future, but also all of my patients. So, shout out to all of the wonderful people that I mentioned. And um, although I didn't get to train with her, I had a phenomenal endocrinologist at Duke, Dr. Lauren Gratian, for many, many years. And she took the best care I could ever ask for my acromegaly. And when she left, as you know, we get attached to our specialty providers, and I was devastated. But I'll never forget all the education that she instilled in me as a patient so that I was able to have such a good patient provider relationship with her where I could feel like I could communicate things that were bothering me, but also what I wanted out of my treatment. She would ask me, the things that were important. And so I hope that other patients in the community will have a provider, just even a fraction of how wonderful she was.
It seems like you've been able to have some very great mentors mentor you along the way, which is very important. Laura, you've been so vulnerable and so open with your journey as a healthcare provider and as someone living with acromegaly. However, right now, we're at the point in this conversation where I want you to finish this sentence. Are you ready?
I'm ready.
While living with acromegaly, I have learned
I have learned that life is a roller coaster of a ride, and it's gonna have twists, it's gonna have turns. There's gonna be up moments, there's gonna be downs. There will be moments where you feel like you've been completely derailed, and other times where you feel like you're right on track. But those are kind of the complexities and beauties of life. I've learned that you can plan life as much as you want, but it's going to turn out the way that it's meant to be. I didn't plan having acromegaly. I didn't plan my 20s being a difficult journey and road. I didn't plan a lot in my life. But I think if those things had not happened to me, I wouldn't have experienced all the beautiful things that I have experienced. One of those being, I have a family, sure, we all have family members, but I have an extended family. I have brothers like you, Tony, who understand what I mean when I say I'm experiencing something that maybe someone else in my biological family wouldn't experience. I have a community, and a very supportive one at that. I have had the opportunity to meet Jill and to know what it means to be a true advocate, not only for yourself, but an entire group of people who are truly rare in and of theirself. And I have had the opportunities to meet wonderful, compassionate, truly caring providers who pour their entire heart and soul into what they do. And I've also learned and experienced what it means to have an amazing partner who is there for you every step of the way, no matter how much turmoil you may go through. He has shown me what it means to truly love someone and care for them despite faults along the way. And I've also learned that it's okay if you get knocked down sometimes, but if you get back up, that makes a world of difference. So as much as I like to get mad at my acromegaly for all of the things that I have experienced, I'm also very, very grateful for it because it has given me a beautiful life surrounded by beautiful people.
That was beautifully stated. And we're just going to end on that note, Laura. Thank you for your time. I want to thank you for joining me today. Most importantly, Laura, I want to thank you for talking acromegaly with Tony. It's been a pleasure having you today.
And thank you, Tony. I really appreciate being here with you today. Every time I listen to the show and the individuals that have joined you, I'm truly amazed at the work that you do because it has such an impact on not just patients who are living with this and experiencing similar things that you and I have gone through, but you are educating generations of providers who understand to some degree the pathophysiology, but you're helping translate the lived experience for those providers so that they can go and have an impact on their patients, which will then improve the quality of life for so many people. I remember meeting you at a conference, and the whole time I was at that conference, I asked myself before I saw you, when am I going to be able to meet Tony? I've heard Tony's name so many times. So many times. When am I going to meet him? And I remember you welcomed me with a nice handshake, which followed by a hug afterwards. And I knew that you were my family. So thank you for having me here today. And thank you for all the things that you do.
We are definitely family. Thank you for your support and your kind words. So, in closing, Laura, this conversation has been incredibly meaningful to me. Your story is a powerful reminder that sometimes the very challenge we never asked for becomes the path we are uniquely called to walk. You were diagnosed with acromegaly at just 22 years old, and instead of allowing that diagnosis to define you, you used it to build a life rooted in compassion, purpose, and service. Today, you care for patients at Emory Healthcare, support your family as a wife and mother, continue your own treatment journey, and you use your voice to educate both patients and healthcare professionals alike. That's remarkable in itself, Laura. Thank you for your honesty, your vulnerability, and for showing us what it looks like to transform adversity into purpose. If you found interest in this episode, drop a comment, share it, like it, hit that subscribe button, please. You can also follow me on all my social media platforms. If you're interested in hearing from a highly skilled neurosurgeon doing incredible work in minimally invasive pituitary surgery, click here and watch a conversation that I had with Dr. Karen Masmaro. Be strong, be encouraged. Thanks for watching.